My name is Kelly, and I am the University Village Site Coordinator for Network 6. Welcome to Face to Face. Today, our presenters are from the Office of Student Health and Wellness about children's vision and dry eyes. Our presenters for today are Catherine Hudson and Dr. Stephanie Johnson-Brown. Would you guys like to introduce yourselves?
Yes, I am here. Hi, I'm Catherine Stafford Hudson, and I am the program manager for the vision exam and the dental exam program. And I've been with the district now for about 12 years. The program has been in existence, the vision exam program, school-based vision exam, since 2011. So just so happy to be here and to talk about this current issue that we have, and to share more information with parents, and just to get the word out about digital eye strain and the possibility of dry eyes in children. Reduce digital eye strain in children and the potential of dry eyes in some of our students with myopia, and in fact, some of our other students too. Next slide. So we just want to talk about the mission of the Office of Student Health and Wellness. And so we aim to remove all health-related barriers to learning and advance health equity in Chicago. And that is what our office is here to do. We're going to talk a little bit more about what that entails in the next slide. So I am going to make sure that I go slowly so that the interpreter can interpret my words. We're going to talk about a little bit about supporting the whole child. And most schools and parents know that CPS takes great pride in supporting the whole child. And when we say that, what we mean is that every student in every school is healthy, safe, supported, challenged, and engaged in a holistic approach that connects everything, the physical, mental, and social and emotional health of a child. And so when we talk about our Office of Student Health and Wellness, we are talking about a couple of different departments within our office, and one is around health promotions. And they have recess, as well as our growing garden program, where we actually go to schools and teach students how to garden, and then the cafeteria actually uses the food that the students grow, as well as nutrition and some of our nutrition policies, our mental health division, as well as our whole child approach. Next is our health information, and that's just around data management and communication, as well as technical assistance around what we call healthy CPS. And then our student health services are our vision and hearing screenings, which we go out and we see every single school, and it depends on the grade level, as well as our special education students we screen every single year. We have an extensive and robust vision exam program, which I will talk about, where we see almost 50,000 students. We have a robust dental exam program. Our partners is the Chicago Department of Health with both of those programs. In our dental program, our oral health program, we see approximately 80 students a year, as well as our school-based health centers, which are in about 22 of our schools. We also have children and family benefits, which really talks about Medicaid and SNAP and food stamps, making sure our families have medical insurance, our students have medical insurance, and that they are provided every service that is available to them. Then our COVID response team, and that's around contact tracing and COVID-related responses, vaccinations, as well as our COVID testing is all under COVID response. And then new to our office is our nursing department. which includes all 500 and some odd nurses who handle all of our IEP and 504 work, as well as some of our communicable disease supports from our nursing staff. Next slide. So now I'm going to talk more specifically about the school-based vision exam program. And next slide. So we're going to talk about the objectives for the day. And we're hoping that this presentation really leaves you with some great information. We want you to be able to know when and how to access all of our vision services for students, and make sure that you can share that information with others, understands ways to reduce and kind of negate the impact of screen time on our children, to understand the possible impact of dry eyes on students, as well as the impact of myopia, what we call myopia progression in some of our students. And then we'll have a whole page of additional resources that will be helpful to you. Next slide. So the two very distinct programs that we have is our school-based vision exam program. And this program is for every single student within CPS from pre-K to the second grade. It is done in each of our schools. So the school has the opportunity to coordinate and invite a provider into the school to provide the services. Eyeglasses are definitely a part of the service. So the students will receive a comprehensive eye exam as well as glasses as needed. And then we have a really robust replacement eyeglass program. So if the glasses are broken or lost within the first year, then we will replace those eyeglasses. And all they have to do is make a phone call to the provider. They will place the order and get the glasses back out to students. The other opportunity that we have for our parents is over at the Illinois Eye Institute Lewison Center. And that's a year-round clinic. It's there all the time. They're even open on the weekends. They're open on Saturdays. And they provide the same services for our students that we would at the school. It's just in a setting at the Illinois College of Optometry, which is on 32nd in Michigan. So parents can call in, make an appointment, take the children over there. If they are uninsured or underinsured, we make sure that those students are provided the service. They get the full comprehensive eye exam, glasses if needed, replacement glasses if needed also. Next slide. And so when we talk about a comprehensive exam, we are talking about basically very comprehensive. We do the case history. There is refractive error done. We do visual acuities and all of those efficiency exams like eye posturing and eye tracking, which is really important for students to have because it will tell whether or not a student is able to have any of the other vision disorders or is having problems with tracking, which has to do with their reading. So it's really important that we do those visual efficiencies exam, as well as dilation if the parents give us permission, as well as visual processing. So a pretty thorough, comprehensive exam designed especially for children, which is really important. Next slide. So we like to recommend that certain students, of course, are signed up for a vision exam and receive a vision exam. And those include those students that are new to the district. There's a state law that says all kindergarten students must have a comprehensive eye exam by October 15th, as well as we recommend students with IEPs and that are in our MTSS program. So there have been some problems have been identified for those students. We want to eliminate and make sure that vision is not the problem. And then of course, students who have failed the vision screening. So there's screeners, technicians that come to the school. If a student failed, we highly recommend that they receive a comprehensive eye exam. And then students that are recommended by teachers because they're in the classroom and they see the students. So they are very good at diagnosing this for us. And so if you could just click on the how to tell if your child needs eyeglasses. And this is a really nice tool. What it is it's a explanation of what a student looks like if they might need glasses. And we usually give this to teachers because they are dead on. They're in the classroom with the students. They can really identify this. And sometimes we think about it. If we read it comprehensively, we'll know. But if we don't really think about it, we don't remember. So when you see a child that's squinting or tilting their head, they're trying to focus. When they sit too close to the television, if you see that they lose their place while they're reading, or they cover one eye when they're trying to read, all these are signs that they could possibly need glasses. They complain of they're rubbing their eyes, excessive tearing. If they use their finger after a certain grade level, like fourth, fifth grade for sure, if they're still using their finger to read, they probably are experiencing some kind of eye tracking problem, and they definitely need to be have a comprehensive eye exam. The other thing is light sensitivity is an indicator, as well as frequent headaches. So this list is really important. We tell parents to keep it around because sometimes you think about it, but you don't think about it. And when you read it in this setting, you're like, oh yeah, that's definitely a sign. But if we don't see this sheet of paper or see these reasons, we don't really think about it. So thank you for that. And so we talked about the reasons and who we recommend. And the next slide. So these are some of our resources. And if you go down and click on the vision and dental resources, it really tells all of our resources. We have a great partnership with Tropical Optical, and they have approximately 4 locations, as well as the Illinois Eye Institute, the Lewison Center. And those are all partners that we work with. So if a child is underinsured or not insured, we make sure that those eye exams and those glasses are covered for our students. And then there's the hearing clinic, which is another resource, as well as some dental clinics, just in case parents need to provide, the child needs dental services. And then of course, those services are limited in cost. If there is no insurance, there is opportunity there for the child to be seen. So next slide. All right. I think the next slide is, this is really minimizing the impact of screen time on students' vision. And so I am going to hand the baton over to Dr. Stephanie Brown. I'm sorry, Dr. Stephanie Johnson Brown, to talk more about the impact of screen time on our students' vision. Dr. Stephanie?
Okay, I can start. Good evening. It's a pleasure to participate with such a great group, and hopefully I can help you understand some of the concerns that we have about your child's vision. I have been affiliated with Chicago Public Schools for a long time as part of the Plano Vision Center, or the Plano Child Development Center, which is a not-for-profit vision care organization that actually gives a lot of students free and sometimes on ability to pay basis vision services, whether it's at a health fair screening or whether or not we go into some of the schools in the suburban areas or daycare centers. We also provide a service that might be one of the services that are on your referral, which is called vision therapy. So that's how I've come to work with Chicago Public Schools. So for today, what I want to talk to you about is minimizing the impact of screen time on a student's vision. And next slide, please. So sometimes, why should these kids have the breaks? And I think since we've been having our pandemic going on, I've seen a real increase in different types of symptoms that I've been seeing in the children, as far as eye strain, eye fatigue, blurry vision, the dry eyes. So I've been noticing that more. And so I know that it's because they've had to do so much screen time. So the fatigue happens because there are muscles in the eyes. And I had a model. I guess you can't see this through the model very well. But this is a model, and I'm not seeing what you're seeing. So hopefully you can see that this is a model of the eye. But connected to the eye are eye muscles like this. And you can see them here. But these muscles turn the eyes in and out, up and down, sideways. And sometimes by doing this, when you read, your eyes turn in more. So as your eyes are turning in more, that makes the eye muscles work even harder. Now, inside of the eye, I don't know if you can see the model. So here's the front of the eye, here's the inside of the eye. So we have a lens on the outside, we have a hole here, which is the pupil. The information goes in. And inside, there are more muscles. Can you see this?
Dr. Brown, if you could just raise it a little bit so that,
Right here?
there we go, perfect.
Okay, so here are these muscles compared to the skeletal muscles, which are on the outside of the eye, which is here. So you have lots of muscles working, having to make a contribution to this eye fatigue that the children are having. But the muscles on the inside, here is a lens. This is the lens that's inside the eye. And usually when you look far away, instead of it being round like this, the lens becomes elongated, more like an oblique type of circle. As you look far away, when you read, it gets fat like this again. Well, these eye muscles on the inside do this a lot. And so a lot of times when the children are doing a lot of inside close reading, we have a problem with it over focusing sometimes, because they're concentrating on that screen for extended periods of time. So a lot of times too, the lighting is not the best lighting that the children are seeing. So we have to control the brightness on the screen is important. Now, the reason a lot of the children get the blurry vision is, and we'll talk about that when we talk about myopia or nearsightedness, when the child looks far away, what happens is the images come to the back of the eye and it's supposed to focus right here on the back of the eye, and this is the nerve that's taking that information to the brain. So as you can see, the eye is nothing but an extension of the brain outside of the skull. But what happens when a child focuses, the information comes, a lot of time they overfocus and it comes in front of the screen. So the lens of the eye, this eye muscle has to adjust to put the information back here again. So depending on how they're focusing, the children will say they have blurry vision. So you have to question your child. Does it stay blurry all the time and it's never clear when you're looking at the bus sign coming or at the screen, the whiteboard type of screen, something far away, or does it come and go? So the come and go type of blurry vision is the one that's concerning, because a lot of times the kids won't complain about that because it doesn't stay blurry. So that's an important question to ask your child. Do they see the in and out of focus, whether when they look far away, they see it clear, but then when they look back at their screen or at their book, it goes out of focus and it's a little blurry, but then it gets clear. Or they're looking at their screen or their book and it's clear, but when they look far away again, it goes out of focus. So though, but it doesn't stay out of focus. And this is kind of like when they look back again, they can't make it focus. And that's what we kind of call the focusing system is locking up. And they see this blur too. So we are seeing quite a bit of that. And then finally, we're seeing an increase in my kids' dry eye. So usually I see that in my adults, but now I'm seeing it in my children. And one thing that's happening is when you stare at a computer, you tend to not blink. You just do this because you're so into it. And you usually when you're blinking, that exchange of blinking exchanges the tears so that it doesn't create little dry spots on the eye, causing the eyes to feel dry. And then the children will have a lot of complaints like, oh, it feels like something's in my eye, gritty. Well, that's because all of the debris in the air, the grittiness is not getting washed out with the tears because it's drying out. Or they'll say, oh, it's a little blurry, but it kind of comes and goes. Or they'll say, oh, it's burning my eyes. So a lot of these things we tend to see, and I do suggest you go to your eye doctor with this to kind of have a suggestion as to whether or not they're going to suggest the artificial tears, or they're going to just tell you to blink more, or if they're going to tell you to use these warm compressor masks that, you know, you can buy them at the Walgreens, CVS, and it's just a moist mask that you put in the microwave and then you put it on the child's eyes. But you should take your instructions from your eye care professional. And then finally, we see an increase in myopia. So there's a lot of research going on now. We'll talk about this a little later on children becoming more myopic or nearsighted. So that means that this functional problem where it was coming and going now becomes a structural change. And so when the child looks far away, it's actually blurred and it's not changing, it's staying blurry. And there's some studies that have suggested that computer use and doing a lot of close-up work actually causes the nearsightedness, but it's just a lot of correlation. So there, it really hasn't been proven yet, but we do see this trend. Next slide. Next, oh, thank you. So we have some suggestions in order to kind of give a little relief that you can do with your child. And one of the best rules is the 20-20-20 rule. So the way that it's easy to remember, every 20 minutes of doing close work, not necessarily only the computer, but just staring at something up close, you're going to look off a distance, at least 20 feet. And if you think about 20 feet, that's bigger than a room. So sometimes you may have to look out the window, you may have to look up at the ceiling, you may have to get up and go look down the hallway in order to get that 20 feet distance. And basically, you don't have to do it for very long, just about 20 seconds. And this is not hardcore, it could be 30 seconds. So it doesn't have to be hardcore, it could be 30 minutes or 30 feet. So just an idea of that, if you do that, but blinking often, when you're looking away, just blink, just have a conscious effort of blinking to keep the tears moving. And maybe you might need to adjust the lighting on your computer. So you should not be having this computer in a place where you have creating glare problems with the light shining directly on the computer. So you should, and we'll talk about a rule for that, about how bright you should have that computer screen. But there's a lot of mechanisms on your screen, whether it's a phone or whether or not it's the actual computer, that will help control this. But one of the biggest things that we have found is taking a break away from the computer after a period of time. In fact, there's research, especially for young children, that actually has found that, you know, around an hour and a half to 2 hours of screen time is enough for young children. So a little bit more, of course, for older children. But what they found is if you kind of keep it reduced, even if both parents are nearsighted, after a while, they won't tend to be as nearsighted. So we can talk about that more when we talk about myopia. So next slide. So what can parents do? Well, you can observe. So if you see any of these things with your children, of course, you observe that they probably need to go to the eye doctor. I advise parents to go to the eye doctor even if the kids don't complain. You go for a checkup for your regular body, and if you think about it, your eyes is part of your brain where all your learning is happening. So you need to go to the eye doctor every year also. So make sure you get annual eye exams for your children. Monitor their screen time as we've discussed. And sleeping. A lot of our kids are sneaking and staying on their phones. Take them away at nighttime so they cannot stay on the phone. They need to get enough rest. And the American Academy of Pediatrics recommends children not sleep with the devices. In fact, a lot of us, you know, I know it's easy to have that as a babysitter, but we should not. We should definitely take it away, even the television, so that before they go to sleep, the last thing that they've done is not have watched a screen. A lot of times this hinders, even for you as adults. Think about how many of you have a hard time falling asleep. And if you think about it, what you did right before was you checked your emails, you're on your phone, you're watching a good movie, and then you're trying to go to sleep. So cut that out at least 1 hour before going to bed. And then finally, nutrition. Get a balanced diet, make sure they're having their vegetables, make sure they're getting another vitamin D. And we've had a little bit of research out there about vitamin D insufficiency and the children with myopia progression or nearsightedness progression. So definitely that's things that the parents can actually do in addition to encouraging their children to blink more often. Next slide. Exercise. Exercise is so key. And I know when it gets cold, it's kind of difficult to have your children go outside. And then with us being in Chicago, we know some dangers of being outside. But outside just means letting them get some vitamin D sunlight, some type of way. And then the second thing about outside, we tend to play when we go outside. When we go to the park, we're moving our motor skills. We're looking far away. When you go outside, you have the best chance for your focusing system to totally relax. And think about those of you who've gone to the beach and you looked out into the sunset. It really makes you relax because you're totally relaxing your visual system, which if you think about it, you have one brain that has two parts, automatic part, and then a part that's a little bit more conscious that you think about your movement. And these two should work together. So when you go to some place like a beach or to a park, and you see the trees, you're totally relaxing, not just your body, but you're relaxing your eyes. You're also giving those kids a good workout and they're learning to focus at different distances. And of course, as we said before, the natural sunlight with the vitamin D. In fact, there's some research for children 6 years and under. The formula is 2 hours to an hour and a half of outdoor and 2 to 1.5 hours of decreased screen, only that limiting screen time. And those kids tend to not progress with the nearsightedness, even if both parents are. If you do it younger, if the older kids, you can maybe limit it if you do that. And of course, the last thing I told you about, you just try to get your kids to blink. And if you just observe your children in front of screen time and watch how many times they blink. The room humidifier definitely does help too. So if you have that for your child, that will help the moisture in the air also for the kids. Next slide. Okay, so there's screen, I said we were going to talk about the screen positioning time as a desktop or a laptop. It should be slightly below your eye level. And so that you can look up at this away from the screen from a distance to kind of give your eyes some relief. So as you concentrate, you have a tendency to really stare and open your eyes. And the more you open your eyes wide, the more they're going to dry out. So we have another little rule called the 1-2-10 rule. And the 1-2-10 rule is if you have a mobile phone and your kid have it up here, that's terrible. If you have a mobile phone and the kids are up here, what you should do is have them ideally about 1 foot away at least. And if they're a big kid, it should be even further. Desktop and laptops, 2 feet. And then a TV screen, at least 10 feet. And you know how many children like to, even if you have this gigantic screen in your family room, your little kid wants to go sit in front. And so I have more kids coming, parents coming to bring their kids saying, they can't see because they have to sit so close to my big screen. But the reason they really sit close to the big screen is because they can pay attention better. So think about it. If you have to sit way back on the other side of the room, everything else going on in the room, you want to look at it. But if you can get close, then you can just focus on the television. So most of the times, that's not a good sign that they cannot see. A better sign is if you notice they can't see when you go outside, everybody else sees the airplane, they don't see the airplane. So relatively speaking, that's how you know. Or you have little children that are really holding everything up close to them or getting close to everything, not just the television. So that's a better sign. The lighting, we discussed too, so you got to cut down on the glare and the fatigue when you're using the screen. And a good rule is about half of what it would be for other activities. So if you have to have another good thing is if you're writing, you should have natural light, not this fluorescent coming behind the child with the paper. So if you had that much light coming on the paper, you don't need that much light on the screen. So the screen should be about half of that in the first place. That would make it much easier. So those types of things, you should take that into consideration. Next slide. Okay, so now we're going to go into what we call myopia. So next slide. So this is a big buzzword, myopia control. How do you control myopia? And so a lot of doctors are really advocating for this, and some of them are actually practicing different types of things that have been proven to really help slow down nearsightedness. And you can't really tell that a child has progressive nearsightedness or myopia unless you've seen them more than once. So if you see them 1 year and they come in and their nearsightedness, let's say they're in second grade, is a 1. And then next year they come in and they're second grade and it's a 3, that's a big problem. Now you can say it progressed too much. So, so that's one thing that basically that we're concerned about now. So of course they're going to complain about the blur at bar. They can't see the board, and the teacher's going to pick them up right away because they're going to have to let them sit in front. So they'll send a note home to the parent. And if they don't listen to the child's going to have to squint to see, or they're going to talk to the child next to them to ask them what's on the board. And so they're going to get in trouble. The ones who are severely nearsighted, they have to bring the paper up really close to see. And of course, they truly have to sit close to the TV because they can't see, only if they're severely nearsightedness. So normally severe is of course like people in the 10, but our real concern is when you hit that, if you hit that 6, that's kind of like where it's going to actually could cause damage to the back of the eye, and even to the point of maybe having an effect on the pressure in the eye. So we definitely are trying to really watch children who are significantly nearsightedness. Next slide. So we're going to talk about this myopia, and I kind of talked about it before with the model, and I'll bring my model back again. I'm going to take this lens out, but okay, let's see. I took the lens out. The lens went right here, but I think it's going to fall out if I keep holding it. So the light goes in, it goes to the back of the eye like this. A person who is nearsighted has a long eyeball. So if your eyeball is long, is basically this, let's say this is the average size of the eyeball. But let's say your eyeball now, so this is the nerve, but the actual surface of the back of the eye stops here. You have a longer eyeball, but light comes in from a certain distance and it still stops here. So you're going to see a big blur circle. So the more nearsighted you are, it's going to be further. The blur circle here is going to be even more so. So that's the sort of thing that we notice in nearsightedness. Sometimes, look, I was mentioning it to you before, and that's why in the diagram you see the image coming to a point in front of the back of the eye, because that's a longer eyeball. But there's such a thing as like false nearsightedness. So some kids come in and you really, when we put the eye chart out, they really are saying they can't see it. They're saying and you sitting in the exam room and you hear that and they're not lying. They really don't see it, but it's like pseudomyopia or like a false myopia. But remember, I was telling you about this lens in the eye here. So if your focusing system is not working properly and this lens is not focusing the image on the back of the eye where it should, it's over focusing. So it's putting it in front of the back of the eye. Your child is acting like a nearsighted child. So of course, eye doctor that's aware of this is going to not just treat the the actual symptom of they can't see, we have ways that we figure out what a child's true prescription is. And we use this instrument called a retinoscope, and we shine this light in their eye. That's how we examine babies. And we can look at the reflexes that we see in there and determine, exactly what you see. If you see 2200s, if you see 2020, if you see 2040s, which, for example, 2040s just means you see at 20 feet what the average person can walk back to see 40 feet. That's all it's telling us. So we use methods like that. Sometimes when the system is very, very spastic or focusing is out of whack, we put drops in the eyes. And this is not the types of drops that we just do to dilate the eye. So basically, just for your information, because parents get confused about this. So here's the eye again. When we dilate the eye, let's say this is the normal size eye pupil. When we make the pupils dilate, means to make bigger. So now that little circle in the middle may be almost the same size of the whole blue part. So it becomes really big. But you can imagine how limited view we see when we only can see this much with a small pupil. When we dilate, we get a wider view. So that's why. And so nearsighted people who have a little bit more damage that might be happening in the back of their eye when they're significantly nearsighted, we definitely want to dilate them and take a better look. But sometimes we do what's called a cycloplegic exam. And what that means is we put a different type of drop in, but it makes the pupils bigger. It makes them stop reacting to light, but more so than anything, it paralyzes the focusing muscle. So now we can get a true, when we shine this light in their eye, we'll get a true idea of what their real prescription is. Most children, if they don't have this problem, we'll just give them a target, a cartoon, or something to look at far away on the eye chart, and we shine the light on, and that relaxes the focusing system enough so we can really figure out what their prescription really is. So a little bit of more information so that when you're watching a doctor do an exam, you'll know what's going on. If you go to a doctor and you have a child, I have a problem with this, and it's a child, and the doctors, we do have these wonderful instruments which estimates your prescription, and all eye doctors have one in their office. And you do it all the time with one instrument does a little air puff for your pressure reading, and the other instrument estimates your prescription. The problem with this, even the ones they're doing online, is that it doesn't control for this false nearsightedness and the fixation distance. So a lot of times what's on that little paper that comes out for a child is way different than what we find when we're doing it in the exam room. So my pet peeve for children is if it's a doctor that specializes in children's vision, they can do that test, but you should see them shining this light in front of the child's eyes. And you should see them also using this instrument, which is the ophthalmoscope, or using the microscope. It's a different method that we use to look in the back of the eye with a little lens. So they should be using some other type of, that's not the same. They're two different things that we're doing. So I just want parents to be aware of that. Next slide. The typical progression of myopia, like I told you earlier, is about 1/2 to 1 unit. If it doubles in a year, that's not a good thing. And it changes. And these studies have found out that it varies with if both parents are it, one parent has it, or if what your race is. So it's definitely more prevalent in the Asian American race than it is in another race. So those are things that the doctor takes in consideration when they're taking your history. So the initial plan is just to examine the child for the first time. So when they come back, there are different other types of things that we will take into account and talk to the parent about if they're interested in controlling the myopia. So I don't know if some of you have heard of some of these methods, but one is these drops, but it is a very small dosage, like what I was telling you about before, but it's very small and it doesn't really blur the child's vision. But the atropine eye drop treatment is one, so you have to be under the doctor's care. And then the second type of way that we, which has been proven to work, is to use contact lenses. So there's this type of hard contact lenses that the children sleep in at night, and it kind of molds the cornea itself, but it also works on getting to the point where they don't need to wear contacts in the daytime. They definitely see without them. So that's a very expensive technique, and they're considered cosmetic. So it's kind of like braces. So if you think about how much extra money you pay for braces, think about that's how much more money you're gonna pay for ortho-K, which is what that technique is. And then also there's a technique where we use bifocal contact lenses that have proven. And a lot of parents say, oh, my kid is 8, they're not responsible. But sometimes for little kids, when it's progressing, I teach the parents how to put them on, but it's only certain contact lenses that have a made-in bifocal in it that it really works the best. And then finally, when you have nothing, you have a medical card, that's all you got. The doctor may suggest a line bifocal. So you'll have a line, you know what a bifocal is, it has like a line across the top. And that has also showed some, in certain types of eye coordination cases, that it actually slows the progression of the nearsightedness down. So you have to go and talk to an eye doctor, and just make sure you're talking to an eye doctor who is decided that they want to try to manage myopia. And they have within their practice management of myopia mechanisms in place that they're using. So you can talk to them. Next slide. Oh, this is the last slide. So these are additional resources that we have. There are the first one, the College of Optometrists and Vision Development, which is COVD, is a group of eye doctors that specialize in not just looking at the physical part of a child or a person, period, eyes, but they look at the functional part. And they do specialize in rehabilitative type of therapy that we do in people who had traumatic brain injuries, or also vision therapy, children who have eye coordination problems or focusing problems or processing problems. So those are doctors who you can look up there and you can find a doctor near you with that. The other one that's that our doctors have is the optometrist.org network. So you can find that, some information from that. And you can see some of the other ones. So I'm going to end now in case there's some questions.
Is there anything you guys need for Dr. Johnson to reiterate or to go over a little slower for the parents as the interpreter?
So, is there anything that needs to be gone over again? Or are there any questions for either Miss Brown or Miss Hudson? If not,
There are no questions in the chat at this time.
okay, I am gonna, let's see if any parents can think of any questions. Maybe to get a couple parents thinking about some questions, I have a couple. You were talking about the screen time and how screen time can often, I guess it'll have an effect of dry eyes on children's or even adults' eyes. Very popular now are the blue light glasses.
Right.
So can you talk about, does that even work? Is it beneficial? Is it just a gimmick?
Good question. No, the blue ray light does work. So the concept is, what happens is it works on kind of like getting rid of the rays of light that's coming out of the computer that actually are interfering with your visual stress. And it also is working on the melatonin level within your body. Those of you who know your kids can't sleep, you have to give them the melatonin supplement to sleep. Well, these actually have an effect on that too. So it's very helpful. The other thing that I want to add to that, I am a proponent of anti-glare coating. The blue light coating is just a type of anti-glare coating. You don't have to get the blue light one necessarily, unless your child is really super sensitive to the contrast. Those are the kids that it's most beneficial to. Or if you have a child that is really having a lot of trouble getting to sleep at night because they were on their devices and they shouldn't have been. Those are kids that it's good, but it definitely doesn't hurt. So if you're someplace and somebody is saying, oh, you should get this, well, and then your insurance covers it and you don't have to pay any extra money, it's not going to hurt you. Just you can get it. But if it's something that you have to make a big sacrifice for, just ask them for the premium anti-glare coating. You don't want to get whatever this, I don't want to name any of the quick places, but they just have it in stock and they don't charge very much for the glare coating, but it might peel off. So you don't want something that's so cheap, the glare coating will peel off. So you want to just pay for the premium without having to necessarily get the blue blocking type of glare coating. Hopefully that helped.
Yes, thank you. And then I just have one last question about, can you talk about or touch about the importance of eyes as it relates to the rest of the body, whether that's, I guess the mind and how it relates to the mind and how it can affect people. And some people might think, it's just dry eyes, I can fix that, really simple. Can you talk about just like really how important it is in relation to the rest of the person?
So definitely. So the eye is the only place in the entire body you can see what's going on in the blood vessels without cutting you open. So we can look in the eye, especially picking up a juvenile diabetic. Okay, so you can see diabetes in the eye. You can see high blood pressure in the eye. So having an eye exam for eye health is wonderful. Having an eye exam for external eye health for dry eye to see is, because what happens is severe dry eye will damage the cornea. And that cornea is this real transparent layer. And you'll end up with like red eyes like this because it's so dry. So it's a telltale sign. Dry eye also comes with some other types of medication. If you have some medications causes dryness, cause dry in your eyes, dry in your throat. So it's a side effect. So maybe you need to go back to the doctor if it's causing that side effect. And then sometimes dry eye is hormonal. So as your hormones are training, because the gland is a hormonal gland. You got one brain, I told you. So if something happens to trigger it, it's going to trigger everything in the brain. And then finally, I want to say the eye tells you a lot about everything. So it's a window to the mind. So when you do an exam, you can kind of pick up on a person that's really, really intense, anal, over focusing, and they need to chill and relax. And you can pick up on a kid that's way out there somewhere else in earth. Okay, and you can sometimes pick up on emotional issues, like what's going on with you. I have to be very careful when I do exams to express people when I can kind of see what's happening in the rest of their world, because some people will break down and actually start crying. So because you can see this through a vision exam, and it's an art to it. And not all eye doctors are able to do it, but all eye doctors can look in the back of the eyes and say how healthy it is. All eye doctors can look at your eyes and say, oh, this eye is wandering, or this eye is lazy. All of them can do that. There's something we can do to correct it. They can all refer. If they don't have a treatment plan, they can all refer to someplace else, even if they're referring to the college. So that's, and then I've left in the last slide, I think it's our information for both Catherine and I, and they're more than welcome to contact me through my email and discuss any other concerns they have.
I have one question for you, Dr. Johnson. The concern that we have around students with dry eyes in particular is a kind of nuanced or new phenomenon. Can you talk just a little bit about what doctors are seeing now since post-COVID, since the pandemic, of students with being diagnosed with that condition?
Yes, so we're seeing a lot more kids who are complaining about their eyes feeling gritty, and they're tearing. So they tear a lot too. And the reason you tear a lot and your eyes are dry is because, think about it, if you stare like this and you never blink, all of a sudden your eyes start burning. And then they start tearing, and they're tearing as a reaction to the eyes being dry. It's saying it's dry, I have to tear a lot. So now you're going to have excessive tears, and the tears are going to come down. So we're seeing that more often, and we're thinking it is because of the pandemic. We've had to do so much learning, e-learning wise. And the kids haven't been taking the breaks. And so if ever you're at the eye doctor, one screening test we use, if you want to see if your eye doctor is doing this, is when the child is in this microscope type machine, we actually put like a fluorescein strip like this. It looks like this. And we just dab it on the white of the eye, and it makes things look yellow to you. But when we look in this microscope with a blue light, it looks green, like the hawk's eyes. And what we're looking for is to see if it stays a nice green, even, because you're tearing great. Or if all of a sudden we see dry spots, we'll see like little black spots when we're not supposed to see it. We'll see a nice, even green. And that's just something quick that we do if the child is having that symptom. And so the parents have to tell us, I've been noticing their eyes have been tearing. I notice they keep saying they're burning. I notice that they always are saying something's in my eye, and I look in their eye and there's nothing in their eye. So sometimes we see that too. So those are things that parents can observe and make sure they bring it to the eye doctor's attention.
Thank you, Dr. Brown, for this wonderful insight. I will say that I have dry eyes due to a condition that I have, and it really affects, the rest of my body and who I am, and, the things that I can do, because you really need your eyes to do everything. How do you reach for things and your depth perception? And so I think we have one set of eyes, and they work together. While yes, you can be with one eye, it's not as good as having two eyes. So I will say to remember to thank you for reminding us to take care of our eyes and how important they are. So thank you, Dr. Brown and Ms. Stafford Hudson, for joining us today. Are there any last points that you would like for the parents to know today?
I'm just sorry that I went so fast. I forgot I had an interpreter, so I apologize. But I do have a Spanish-speaking staff person here, so anybody that wants to call, or they just leave me a message, I'll have Daisy calls back. She does some presentations for me too, so she could explain it to them also, okay?
All right. Well, thank you so much for joining us today. I am going to.
I'm sorry. I just wanted to say one thing very quickly, that we are working on a marketing campaign within CPS around the whole eye strain issue. And we are going to try to change the behavior of our students by implementing the 20-20-20 rule inside of classrooms. So that's, look forward to that happening. We feel very strongly about that, and that it would be very helpful for all of our students if we implemented that in the classroom while we have the students present. So look forward to that the first of the year. We'll start that.
Sounds great. Thank you so much. So I'm going to quickly share their information for anybody that would like to have it. And That way you can take a quick picture if you have any questions. And with that, I thank you everyone for joining us today at our session with Face to Face. And thank you to the Office of Student Health and Wellness and Dr. Brown for joining us today. Have a great night.
Thank you for
Thank you.
having us. Have a good
Thank
evening.
you.
Bye-bye.
Bye.